for being here and for the work that you're doing. And I want to reiterate what Dr. Hanley said is, what's working, what's not working. Clearly, what we're doing isn't working. And I like the idea of talking about models of innovation and success, but also using sound data so that we have evidence-based decision-making and policies that are going to respond to this crisis. Now, one thing that we heard from doctors at the beginning in 2016, really when BC declared a public health emergency, they were calling for the federal government to declare also a national public health emergency. Can you explain why that hasn't happened? And the reason being is that you've heard me many times, I've met with all of you here on this panel, about the need for a plan and a timeline, and that is not in the renewed Canadian Drugs and Substances Strategy. It was something I outlined in Bill C-216, which was defeated by Conservatives and most Liberals, but that would have provided a timeline. That bill directed government to provide a timeline and a plan. So why is there no public health emergency or national public health emergency been declared?
So I think the Government of Canada has recognized that the overdose crisis is a public health crisis. We've used a broad range of powers.
You even said it was a public health emergency, so why haven't we declared it?
I think we've regularly put out that it is a public health crisis and that there are a number of actions, including investments of over $1 billion that have been made in a suite of actions, including evidence-based actions, innovative actions. That's why we have the renewed strategy to help guide us forward, working in partnership with others. And as you mentioned, with the renewed strategy, really looking at investment in a suite of services and supports, and there are specific actions that we have. There's resources that have been associated and announced in budget 2023, and then for timelines associated, there's specific actions that have been taken, like the call for proposals for this.
I love all the buzzwords around, a compassionate approach, integrated, coordinated approach, but that requires a timeline and resources. I'm sorry, but $1 billion isn't even 1% of what we spent in response to the COVID-19 health emergency. So that's why we need to declare a national public health emergency so that we can force everyone to the table and actually develop a plan with provinces, with municipalities, with Indigenous nations so that it's coordinated.